World Health Organization estimates that in 2021, at least 56,000 South Africans died as a result of tuberculosis. And our country's infection figures have been touted as the highest in the world. Lack of awareness and various socio-economic factors have been mentioned among the reasons for the high rate of transmission and death. Dr. Tasha Koch, co-director of NGO Eh, woza, says TB is one of the leading causes of death in the country. She joins me now for more on this. Doctor, good afternoon, Dr. Koch. It's not a good picture what we're hearing, and the Deputy President saying, among other reasons why we're having such high rate of TB, that people do not complete the treatment.
Hi, Dan. Hi to you and your audience, and thanks for having me. I think it's very difficult to adhere to a full course of TB treatment because, as we know, TB treatment takes 6 months. And so for people who are sick and face other social difficulties such as hunger, it's sometimes very difficult to adhere to 6 months of treatment. There are also side effects that occur as a result of treatment. So one of the research areas that scientists are focusing on is trying to develop shorter regimens of treatment to allow people to finish their treatments in a shorter time period.
Yeah. What are the main contributors, I mean, to the challenges of stemming the transmission? I mean, do socio-economic conditions come into play?
I think socioeconomic conditions are a huge factor. Overcrowding contributes a lot to TB transmission. Lack of access to very good healthcare also contributes to TB transmission and TB treatment. And there's a lot of things about TB as a disease that we still don't fully understand. And so I don't think we've fully cracked where TB transmission is happening and how to stop that transmission. So that's a research area of focus for scientists around the world.
Yeah, and in your work, I mean, are you getting any clarity, or are you still trying to work out what's really behind the transmission?
I think in scientific work, progress is always slow, and we build on what others have found. But I think there's more and more clarity that's beginning to emerge. I think one thing we've realized is that there's a lot of transmission that we're not detecting. So we need to find new ways of finding who has TB and diagnosing people. And I think another really important point to mention is that we really need to decrease stigma around the disease and have effective messaging around the disease so that people who are sick feel that they can go and access healthcare without being afraid or without being stigmatized. So while the scientific research is really important, the health messaging is also very important, and we need to do a lot of work on decreasing stigma.
Yeah, during the COVID-19 pandemic, we learned that we have some of the best scientists and medical scientists in the world here in our country. What's happening in the field of tackling tuberculosis in terms of new drugs, of vaccines? Are we making strides there, Dr. Koch?
I think we are making strides, and I think there's reason to be hopeful. So South Africa is really interesting as a country because we have, as you said, some of the highest rates of TB in the world, but we also have a really good biomedical research infrastructure. So we've got some of the best scientists in the world that are working on all 4 aspects that I think need to be addressed to solve TB. So the first is we've got people in South Africa who are working on new TB vaccines, which is really important because that would prevent the disease. We've got people in South Africa that are looking to find new ways of treating TB, so new drug regimens that can shorten treatments and that can allow for better eradication of the bacterium. We've also got really good scientists who are trying to understand transmission and where that happens and how to interrupt it. And then we've also got people working on diagnostics and how to find those people that we haven't yet found that have TB. And so I think there's hope around that, but we need continued energy around the fight against TB. And I think that's difficult because often the world only pays attention to diseases that affect areas that are the middle class and that have a lot of money, and TB is a disease that most badly affects the poor. And I think we need to have sustained commitments and investments so that research pays off and can be implemented well in South Africa.
So there is hope that some of the work that our scientists are doing around new vaccine, new drugs, new ways of treatment, and understanding what's behind the transmission patterns and the diagnostic, that might help us going forward. But you mentioned stigma earlier. That will speak to also messaging around this disease. What is your research showing there, and what are your thoughts about what can be adapted to be more effective?
So I think when we design messaging strategies, we need to be really creative around how we do that. So we need to think about who our audience is, what they already know about TB, which in some areas is very little. And I believe that if people understand what causes TB and how it's transmitted, there will be less stigma around the disease. So I think there's a lot of misconceptions out there that TB is only a disease that people with HIV get, which is not true, or that TB is caused by bad lifestyle choices, which is not true. TB is caused by bacteria and anyone can get it. And I think we really need to think about how we address those misconceptions through our messaging strategies. And I think our messaging strategies really need to be tailored to specific audiences. So we need to ensure that we design messages that audiences can relate to, where audiences feel seen and heard, and that we stimulate a lot of discussion and dialogue around TB, because I think it's through discussion and dialogue that people can be heard and can ask questions around TB. And I think that could be a really important tool to decrease stigma around the disease.
Yeah, I think the awareness of it is very important. How much does HIV contribute to the stigma? I'm asking this because each time we hear the government, just now, the Deputy President was speaking about this new strategic plan for 2023-2028, and it's for the fight against HIV and TB, and that people who've got HIV are most likely as well to contract the bacteria that gives people TB. We know there's been a lot of stigma in the HIV space. Do you think that also plays into the challenges around TB?
I think so. There's no question that HIV definitely increases one's chance of getting TB and specifically getting very sick with TB. I don't necessarily think, I think HIV does contribute to the stigma around TB, but I don't necessarily think that that's the only reason that there's stigma around TB. So we saw there was a lot of stigma around COVID as well. And that disease is very different to HIV in terms of how it's transmitted and where it came from and things like that. So I think any disease where there's unknowns, where people don't know the facts about the disease and how it's caused and how it's spread, and anything that really affects people's livelihoods and health causes fear. And I think really fear is the root of all stigma. So I believe if people have more knowledge around the disease, there would be less stigma. And I think we really need to work on that.
Yeah, I mean, the numbers are not looking great. 56,000 South Africans dying in 2021 due to TB, according to WHO, the World Health Organization. Going forward, are you hopeful? I mean, beyond the other items you've mentioned around new vaccines, new ways of treatment, I mean, are there other silver linings or other aspects of the fight against TB that you believe we should focus on as a country in order to be more effective?
That's a really good question. I think all of the things that I've mentioned are going to be important to control TB, and I think we need sustained effort around that. I think I am hopeful around being able to work with people, cross-sector, for people to develop messaging that can be effective to combat TB and to decrease stigma. And I do believe that with sustained investment, some of these research aspects that I mentioned will go some way to addressing the TB problem. I think what we need to combine with that is effective implementation and delivery of some of these interventions. So they need to go into a public healthcare system that is functioning correctly. And we know that there's difficulties around some of our public healthcare systems, not just related to TB. So I think if all of those things could come together, I think we would have hope in eradicating TB. And I think there are silver linings, because I think that is possible. And that lines up with the World Health Organization messaging around we can end TB.
Yeah, I guess we can. I mean, if the world could come together in a short space of time and produce vaccines against a new virus, COVID-19, surely we can do better around TB. But, I mean, as we know, TB, most of the people around the world, I think about 80% of the people around the world who are affected by TB live in low and middle income countries. The richer nations are sort of spared this disease. Does that speak to the standing of our countries as developing nations?
Yeah, so I think that speaks a lot to why TB investment in combating TB is a lot lower, because TB is a disease of the poor, and so there isn't a lot of motivation to address the disease. I think you've highlighted something else that's very interesting, is that a lot of the more developed countries had a TB problem, say 50 or 100 years ago, when their social conditions were not as great, and where they had similar problems of overcrowding and congestion. But as the social conditions in developed countries started improving, so did the TB problem. So I think that shows a really important link with social conditions that people are living in and TB rates. And I think if we could start to address those as well, that would be an additional weapon in the fight against TB.
Thank you very much for your time. It's been a pleasure talking to you, Dr. Tasha Koch, on this big challenge. She's a co-founder of the TB engagement non-profit organization, woza. More news shortly here. You're watching Today.